Hi, I'm Angela Douglas from St. Vincent Healthcare. Our hospital boards and senior leaders recently came together to kick off our new model as SCL Health Montana. They spent 2 days brainstorming, collaborating, and planning towards our new regional initiatives, being better together, ensuring quality care close to home, and honoring each community's legacy and history of healing.
We have brought together the board of directors for the 3 Montana care sites, and it has been really outstanding for the members of the 3 boards to meet, to get to know each other, to learn from each other. We all have the same level of understanding, which has really been a great backdrop to really what's next, which is moving into the development of our strategic planning process for 2018.
As you think about quality of care close to home and the objectives that we have as a region, part of that, we will look back in a year and know we were successful if we've increased the volume at each of our care sites and we've expanded the scope of services that we're offering at each of our care sites. And that's quality of care close to home. It's keeping patients in their community to receive care that they can receive there without having to travel elsewhere.
We live in a state that's geographically so diverse and so far distant. This provides us with the opportunity to collaboratively work with the relationships we have with the other sister hospitals to provide care among all of the systems and not have people travel as far to get the kind of care that they need.
I think that the integration of the facilities, it's needed. I'm glad that it's finally happening. It's been tried before, but I think they're going about it now with all the analytics and all the data that's available and whatnot. Where it didn't work before, I see this as being very positive.
Cultivating relationships across the care sites benefits both our associates and our patients. Our associates have the opportunity to learn from one another, again, to use best practices and skills that we can leverage across the region. It gives us the opportunity to standardize care, which will make care more affordable and lower the cost of care for our patients. And then again, from the patient standpoint, it provides excellent quality, consistency in their care, and using the tools from our electronic medical record and then the knowledge and the resources that we have across the system, again, is going to provide excellent care regardless of where they receive that in one of our 3 care sites.
Most of our communities are smaller, and for them to travel long hours for care is really unacceptable. So if we can bring quality care to home with these individuals, we can keep them there, we can keep their families with them, which will help them in their recovery.
The Sisters of Charity's legacy of healing goes back over 100 years. And each one of our hospitals has their history of their group of sisters that came from back east to work here in Montana, and that still remains. Coming forward into the future, we're looking forward to the good that is yet to be. So it's not past, it's our mission, vision, and values into the future.
This only works, it only happens because of our associates. At the end of the day, if you would take the people out of the equation, we would not exist as SCL Health Montana. We're grateful for them. We're appreciative of all the work they do on behalf of SCL Health, the way that they live the mission and the values. That's what makes us who we are.
In the coming months, you can look forward to more updates like this from SCL Health Montana.